everyone, and welcome once again to The Doctor is In. I'm your host, Dr. Freddie Gomez. So in this episode, we'll be focusing on COVID-19 and how it develops into a critical condition. So in previous episodes, pinag-usapan natin ang mga minor symptoms ng COVID-19, ang moderate symptoms. So ngayon, we'll be focusing on severe and critical conditions and how it can even become fatal for some people. So this disease, this COVID-19, mainly targets our respiratory system. Kaya makikita po natin na ang mga pasyente na may severe at critical cases ng COVID-19 ay intubated o nilalagyan ng tubo mula sa bibig papunta sa baga at kinakabit ito sa isang ventilator machine sapagkat hindi na sapat yung pagpasok ng oxygen sa baga ng pasyente. So to help us explain kung bakit nga ba ganito ang epekto ng COVID-19 virus, makakasama natin is Dr. Ronald Fajardo. Siya ay isang interventional pulmonologist mula sa St. Luke's Medical Center. Dr. Fajardo, welcome to The Doctor is In.
Yes, good afternoon, Dr. Freddie. Good afternoon to our viewers.
Now, a lot of viewers are familiar with a pulmonologist, pero baka maraming hindi pa sigurado kung ano ang interventional pulmonologist. Can you explain to us briefly what is this subspecialty all about?
Okay. The interventional pulmonologist basically does yung bronchoscopy, or wherein we insert a camera, a bronchoscope, towards the lung of a person or of a patient, and we can do certain procedures such as do biopsy, especially if we need to diagnose for a pulmonary mass, to get a sample what a pulmonary mass is. Or we can also do certain procedures such as placing stents if there is any obstruction in the respiratory tree, and other things such as doing fluoroscopy, yung sa balot ng baga. We can also insert a camera going there and drain the water there and also see what's causing those conditions.
Very nice and budding new subspecialty. Now, doctor, can you briefly explain to us how the virus affects the respiratory system? Ngayon, pag sinabi natin ng respiratory system, hindi lang po ang baga ang kasama dito, kundi pati ng ilong at lalamunan. And can you also correlate it or itugma ninyo dun sa mga sintomas na nararamdaman ng pasyente?
Okay. There are basically three ways into which the virus can enter the body, So one is the first one would be through large droplets. So this happens, when infected individual or patient would cough and sneeze, and the droplets, the body fluids, the saliva, would go directly to the mucous membrane of an individual. So where are these mucous membranes? It may be the eyes, the nose, or even the mouth. Okay, and the other way, of transmitting the virus would be through aerosols. So basically, the aerosols are more common in the hospital setup. This is when smaller particles of the virus remain suspended in the air, for a particular period of time, for a few hours. And this only happens when you do certain procedures, which are basically confined in the hospital, such as doing nebulization, intubation, extubation, or doing non-invasive ventilation. And the other way to transmit it would be through fomites. So I think this is the most common transmission, especially in the community. So what happens in the fomites? So if an infected individual would cough or sneeze, especially pagka sa kamay sila nag-cough or sneeze, the virus would be transferred to the hand. Tapos that person doesn't wash his hands, tapos biglang hahawak siya sa mga surfaces such as the table, a chair, or even a doorknob. Then the virus would be transferred there. And another person would handle that surface, tapos he would inadvertently again touch the eyes, nose, and the mouth, Then the virus may be transferred to that person. Okay. The problem with the fomites, no, the virus may survive in surfaces for as long as 72 hours. No, so that's why it's important that we would also disinfect the surfaces. So once the virus would enter our mucous membrane, it would travel to our respiratory tract. So the respiratory tract or the passageway po natin yan, no? It's the one that connects the lung to the outside. Okay, so the virus may stick to the linings of the respiratory tract and may cause damage or injury there and go further down to the lungs, no, to the basal segments ng lungs, so dun sa may baba, and it would cause further injury.
Okay. Now, about 15%, Doctor, ng COVID-19 cases are deemed severe. So, what signs define the severe stage ng COVID-19? And would you when could you say that the patient is already critical?
Okay. There are different stages of COVID-19, and as of now, there's 4 different stages, and they say the critical stage is at the extreme end, no? Yung pinaka-severe natin. So there's an overlap with the severe stage as well as the critical stage, no? So pagka-severe na siya or critical ang isang patient, no? So a patient might have a severe type of pneumonia wherein the whole lung may be affected, no? Both lungs are affected, and if this happens, the oxygen levels would be dropping, no? It would be low, necessitating na isang pasyente would be hooked to a ventilator, no? Malalagyan siya ng tubo at malalagay sa ventilator to help the patient breathe, no? Other things na pwede nating masabing it would be a critical stage would be if the blood pressure would go down, no? This is what we call a shock, wherein we need medications to bring the blood pressure up, no, to elevate the blood pressure. Other conditions that wherein we could say that it's critical would be it would affect other organs, no, such as the kidneys. If the kidneys would already shut down, wherein we call it as a kidney failure, acute kidney failure, necessitating hemodialysis or even hemoperfusion. So we call this, no, this is what we call sa COVID-19 is what we call a cytokine storm, wherein the immune system of the body goes on overdrive, wherein besides, of course, fighting off the disease, the problem there in the critical stage is that the body the immune system is also already destroying parts or certain organs of the body.
Now, with your description, Doctor, napaka-seryosong kondisyon pag umabot ang pasyente na sa critical stage. So, na-describe nyo ng mabuti yun, ano? But ano sa tingin nyo ang mga tsansa or what are the chances recovering from pag umabot yung pasyente sa critical stage na dinescribe ninyo?
Okay. As of now kasi, the COVID-19 is a very relatively new disease, no? So wala masyadong experience pa, no, ang ating mga centers, no? But what we have are data coming from the Chinese, no, from China. They have recently three studies indicating yung survival, no? 2 studies doon indicate there is around 31 to 34% chance of survival if a patient proceeds to a critical stage of the disease. And one of the studies says there is a 68% survival. So, makikita natin dito, hindi masyadong maganda ang chances, no? Masyadong mababa. But so far in the Philippines, no, we don't have adequate data so far, no?
Okay, so before we go on answering more questions, let's greet some of our viewers this afternoon from different parts of the world. We have viewers from Madrid, Osaka, Hawaii, New Caledonia, Israel, Taiwan, USA, Riyadh, Kenya, Thailand, Singapore, Saudi Arabia, Malaysia, Nigeria, Hong Kong, Abu Dhabi, Kuwait, and Belgium. Ngayon, napakarami na po. They're all watching. Thank you for watching The Doctor Is In. I am with Dr. Ronald Fajardo, and we're talking about yung severe to critical stages nitong COVID-19. So, Dr. Ronald, no, let's take some online questions that we have from some of our viewers. We have a question from Danielle, and she is asking, is aspiration pneumonia a sign of COVID-19?
Okay. Aspiration pneumonia is a different kind of pneumonia, no? So, ang pneumonia, it may be composed of an infectious pneumonia, no? Can be caused by two different things, no? It may be bacterial or viral. Ang aspiration pneumonia, this is usually a bacterial pneumonia which would usually respond to antibiotics, no? Ang COVID, it's a viral pneumonia, and it doesn't respond to antibiotics. So these are two different things.
Okay, and we'll continue to answer more questions. Thank you, Danielle, for that question. And for our viewers, please keep on sending those questions over our CNN Philippines Facebook page, and Dr. Ronald Fajardo and I will answer them as much as we can, as quickly as we can. But first, we have to pause for a break. But when we return, we'll be talking about the kind of management given to COVID-19 patients on critical stages. So that is something that you want to find out. Please stay with us. And we are back here on The Doctor Is In. I am Dr. Freddie Gomez, and you are watching The Doctor Is In live on CNN Philippines and Facebook Live. So we are still here with Dr. Ronald Fajardo. He's an interventional pulmonologist from St. Luke's Medical Center, and we are talking about COVID-19 and how it attacks our respiratory system, specifically kung napupunta na siya dun sa severe at critical stages. So moving on with the discussion, Dr. Fajardo, no, does the critical stage necessarily involve pneumonia? And ang mas nakakatakot dito is what is actually called an acute respiratory distress syndrome, ano?
Yes, okay. In the critical stage ng COVID-19, pneumonia is always involved, no? Kasi the coronavirus directly attacks or injures the lungs of the individual who's infected, no? So what happens here is the alveolar sacs o yung pinaka basic segment ng lungs natin becomes inflamed, and it fills up with the materials, and it becomes also stiff, no? Once it becomes stiff, it proceeds to what we call yung sinabi natin kaninang acute respiratory distress syndrome o yung ARDS, no? So this is a severe type, no, ng inflammation wherein even if you are already on a ventilator or we're giving high amounts of oxygen, no, there is not enough exchange of oxygen that is going on, or enough oxygen would go into your body.
Ngayon, Doctor, some of the patients, on a previous episode on The Doctor Is In, we had some survivors of COVID-19 recount na meron silang simptomas na nahihirapan silang huminga. Although both of them, hindi sila nilagyan ng tubo at nagkaroon ng ventilatory support. So ang tanong ko is, kailan ba nangangailangan ng, kasi baka akala ng mga viewers is pag nahirapan na sila ng huminga, ilalagyan na kagad sila ng tubo o ng ventilator. Kailan kailangan ang ventilatory support, Doctor?
Okay. The coronavirus usually manifests differently, no, among individuals, no. If you are young and you're healthy, usually it's a mild form of the disease, no. Kahit na bumababa ng yung oxygen levels or yung pneumonia mo is bilateral na or yung parehong lungs is already involved, you may tolerate lower levels of the oxygen without the need of ventilatory support. But if you're already an elderly or you have what we call unstable comorbid condition, kunyari uncontrolled diabetes or uncontrolled hypertension, then mas mahina na yung baseline function, then yun yung mga mas malaki ang chance na malagay sa isang ventilator o malagyan natong tubo.
So, what treatment protocols are you currently implementing, ano? And what kind of interventional pulmonary procedures are needed, if ever?
With regards to the interventional pulmonology, no, we are not doing any procedures in the moment, no, kasi the bronchoscopy by itself would cause aerosols, no, or high risk to have to produce aerosols. But ang mga interventions natin more of a therapeutic, no, yung mga pagkalagay ng tubo, we do give medicines, no, we do give medicines in the patient. One would be yung tinatawag natin convalescent plasma, wherein we transfuse plasma coming from patients who have already recovered from the disease. Kasi yung plasma are rich with antibodies, which is already present among those who have recovered from the disease. No? And the other interventions that we are doing, those who are already ventilated, yung tinatawag nating prone ventilation, kung saan pinapadapa natin yung patient, no? Kasi pagka nakadapa, mas malaki ang chance na bumuka or mag-open up yung mga alveolar sacs o yung airways ng isang tao.
Now, this is an important question. A lot might be wondering, ano? Are there ways na we can improve the health of our lungs to fight COVID-19 infections? Meron bang mga exercises, breathing exercises na mararecommend nyo, Doctor?
Okay. Breathing exercises actually, what can help strengthen the lungs are really yung mga basic lang, no? If we do if we exercise regularly, if we eat healthy, no? If we eat more fruits and vegetables, if we practice good hygiene, this would all strengthen the immune system of the lungs. But with regards to the exercise, no? By itself, no, doing regular exercise like running, no, or walking, no, for at least 30 minutes, no, 3 times a week, by itself would strengthen the function of the lungs.
Okay, so I guess to reiterate, no, there's nothing special in order to strengthen your immune system. Good exercise, good diet is all you need. So nothing fancy, very basic and very simple, and that will strengthen and not just your lungs but your immune system as well. Nanggaling na yun kay Dr. Fajardo. Now, for my last question, I also saw it here. No? I was going to ask you this question, but let's answer some online questions. And here's a good question from Cheryl. And she's asking, does COVID-19 have lifetime adverse effects on the lungs if a person survives? Will they be able to regain their normal capacity to breathe?
Okay. Kasi since COVID-19, no, is a relatively new disease, no, it has just been present, no, actually in our country for the past more than a month pa lang, but the studies that we get are from the Chinese experience kasi sa kanila mas nauna na silang nagkaroon nitong disease na to, and they see the long-term effects, no. Pagka mild disease lang, mild to moderate disease, no, there is usually no prolonged effects, no. But if you go into the severe or critical disease, they said that they saw na the lungs remain stiff, no, for a longer period of time. So that is where what we call the pulmonary rehabilitation comes in, no? So those who have a severe or a critical type of disease need to do lung exercises, no? In the long run, because their lungs are stiffer, or it would be harder for them to breathe in the long run.
So it can vary. It can vary depending on the person, the type of results that will happen. Ano? Pero what can you tell us about asthmatic patients, naman, doctor, and how COVID-19 affects their lungs?
Okay. They said that those who are asthmatics have a more severe type, no? They have a tendency to have a more severe type of disease. But you can prevent that from happening if you continue taking your maintenance medications. Now, if you're compliant with your medications, if you have maintenance medications or like inhalers for your asthma, then that is one of the ways one of the ways to prevent you from progressing to a severe type of disease in case you get the virus.
Okay, now let's answer another question. We have a question from Jeremiah who would like to know, have we seen any cases where someone with tuberculosis gets COVID-19? And if so, what is the best approach to this? So you all know, no, the TB is very prevalent, especially here in the Philippines.
Okay. If you have tuberculosis, your immune system, no, your respiratory immune system is lower compared with a healthy individual. That's why you are more prone to acquire or mahawa with COVID-19. But so if you have if you have tuberculosis, then you have to be extra careful. No, you have to still to do hygiene, no? You need to follow strict hygiene, like still frequent hand washing. Okay, you have to use alcohol when you touch surfaces and others. You always need to wear masks and other things.
I think that's a good way to say it, no, doctor. No, still always go back to the basics. Very simple. Always wash your hands. Good, proper hygiene. Good sneezing, coughing and sneezing hygiene goes a very long way. Now, doctor, there have been some reports, if you're aware of this, that they say that minention nyo kanina on how people are intubated pag they're at the severe or critical stages now. But there are some reports that intubating a patient early, even though yung mga simptomas niya ay hindi severe or hindi critical, pero nakikita na ng doktor na baka papunta doon, pag in-intubate daw ng mas maaga, mas maganda daw yung chances na makasurvive siya if ever man siya umabot sa severe or critical stage. Is there any truth to this, doctor?
Okay. With regards to the early intubation, no, or early placement to mechanical ventilator, there are now two school of thoughts regarding that, no? So initially, during the early stages of this disease, the doctors are saying na it would be better to place the patient in an invasive mechanical ventilator early, no? So kasi if we let the patient still, kung hirap pa rin huminga ang patient, if the oxygen saturation is low, it may affect the other system, no? If we delay it. So if kung early ma-intubate or malagay sa mechanical ventilator, we would immediately correct the hypoxemia of the patient. However, yung recent school of thought ngayon is we can do what we call yung high-flow nasal cannula, which is a type of non-invasive ventilation wherein hindi ka nilalagyan ng tubo. They only place a nasal cannula to your nose, but ang nilalagay na oxygen doon is also similar or as high as a mechanical ventilator. So if you are placed in a high-flow nasal cannula, it would save the precious yung mechanical ventilator, no, from being hooked to you, no. So mas ma-free up yung ventilator to those who are really needing it.
Now, we have another question online from Gloria. Gloria would like to confirm, tama po ba na nagsusuot ang mga tao ng gloves kapag lalabas ng bahay? Hindi po ba delikado ito for cross-contamination? What do you think, Doctor?
Yun. Actually, that is one concern, no, that I see when I go outside, no. People are wearing gloves. Kaya lang some people would think that they are invincible, no. So what they do, hinahawakan nila yung surfaces. Then even with gloves, they still hold their eyes, their nose, or their mouth. Then the same thing, kahit kung may gloves ka or wala, that is reason for cross-contamination. So the gloves would only be effective, no, if you hold surfaces with the gloves, then you dispose it properly without holding your mucous membranes, your exposed mucous membranes, yung sinasabi kong yung mata, yung ilong, at saka yung bibig.
Very good. Now, Jing Jing is asking naman, ang anak ko po ay paminsan-minsan hinihika at laging may sipon. Inaabot ng 2 araw ang hika. Yung x-ray result ay okay naman. Okay. Sorry, nawala na yung question niya. Okay, pero we have another question from Mara. Is COVID virus self-limiting like other viruses, and how long does it stay in the body? Sorry about that, nawala yung question, previous question. So the question is COVID virus self-limiting like other viruses, and how long does it stay in the body?
Yes. Okay. For the coronavirus, it's similar to the other viruses, no, or other flu viruses. It is usually self-limiting in the majority of people who get it, no. So yung mga meron lang mild stage or mild course of the disease, no, symptomatic lang yung treatment natin, no need for hospitalization. So it may remain in the body, no, for some studies would say it would remain in the body as long as for 10 days, no, even as long as 12 days. That is the reason why kahit na gumaling ka na or your swab is already negative, you are sent home and you are still on home quarantine for at least 14 days.
Okay, thank you very much, Dr. Fajardo, for giving time and sharing your knowledge with our viewers with regards to COVID-19.
Okay, thank you, Dr. Freddie.
And thank you also to our viewers. Sana po ay nasagot namin ang inyong mga tanong. So to hear more discussions on COVID-19, please tune in again tomorrow at 3:30 p.m. only here on CNN Philippines. I'm Dr. Freddie Gomez. Stay safe, everyone.